My name is Sarah Long. I'm a professor of pediatrics at Drexel University College of Medicine, chief of infectious diseases at St. Christopher's Hospital for Children in Philadelphia, and I'm the chief editor of Principles and Practice of Pediatric Infectious Diseases, 4th edition. Well, actually, I was conscripted to be chief editor of the inaugural edition and thought I had to think about it many times because I don't take things on lightly, and I saw that there was a need for a textbook predominantly for infectious disease pediatricians and pediatricians in which you could go and you could have a consult in your hand of, I have a patient, a child with a problem. I can dissect that problem and try to get to a diagnosis. And then when I get to the likely diagnosis, I can have an idea, a list, a differential of the kinds of organisms that might cause it, and then the best ways to diagnose and prevent. So I didn't really see that there was a textbook that was so user-friendly. That was more alive than just the list of a differential diagnosis or the list of pathogens, but something that I call, and I say to the students and residents I teach, that I want to teach them how to take care of patients and how to diagnose and treat things, and I want to teach them with an attitude, and the attitude is, how do you optimize that? The primary audience for this book, I think, is a baseline, quick reference for a pediatric infectious disease doctor who's about to see someone in consultation who they may know the symptom complex, and they want to see what the differential diagnosis of that symptom complex is, and be able to look at the organisms that might cause it, be able to then have an idea of where they're going to start. A textbook is never the complete answer. It's never the up-to-minute answer, but it should be more than foundation. So I think that this textbook I wanted to have would be authoritative and be complete and always address the question, how am I going to deal with the patient in front of me? So a pediatric infectious disease doctor, an internist infectious disease doctor who takes care of children, also can be very useful for a pediatrician, that it would be useful to have in every pediatric office, that you could pull off the shelf if you had a child with a symptom complex that you wanted to know what's the differential diagnosis and how might I approach that diagnosis and management. And also would be very useful for pediatricians who want to be able to explain to parents in a little more detail than is provided in information sheets about vaccines exactly the epidemiology of this disease, because we now have parents who don't know anything about many of the vaccine preventable diseases, that this textbook would give them that context that they could explain. The textbook's laid out in 3 major sections. The first section is approach to the patient in whom you don't know the diagnosis, but you know the symptom complex, you know the history. And how do I get to a differential? So that it helps you stratify what are the most serious possibilities, what are the most likely possibilities, what things do I need to exclude, and even what non-infectious diseases should I think about. The second part of the book is, now I know that this patient has pneumonia, and I know that the possible causes of pneumonia are several organisms. I now want to read about pneumococcus because that's a major organism of pneumonia. How can I read about that? Well, the second part tells you very briefly about the epidemiology and the change in epidemiology since vaccines, and how you make that diagnosis best, how you predict best what the best therapies will be, and then the miracle of how can you prevent this pneumococcal infections getting into vaccines. And then the third major part of the book is what you have to know to imbue the optimal therapy or the optimal diagnosis of every patient with an infectious disease. So it's an approach to the use of antimicrobial agents. It's an approach to the use of the laboratory. it is all the mechanisms of resistance of antimicrobial agents, and then the antimicrobial agents themselves. So together, in those three parts, you can really address a lot of issues.